Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Waqar from Child Health Matters. So today I will talk about candidates are doing common mistake in communication station of MRCPCH clinical exam. So the mistakes which usually candidates are doing before entering the station means they are reading the scenario, what mistakes they do while they are reading a scenario before entering in the station. Second, during the communication and at the end of communication. So there are some mistakes which candidates are doing sometimes because of stress, sometimes because of it's not about the knowledge. Definitely you are going to appear in exam, you must have a knowledge. So this communication station, you have to explain. Definitely you need some knowledge, but it's not all about knowledge in communication station. There are other factors examiner is watching in you. So let's talk about it. Before I go further, please subscribe my channel for further videos so that it will help you in exam especially. Okay, so before entering in exam, candidates are not reading scenario properly. The instruction on the scenario, sometimes candidates only read the task, they focus on the task. Yes, you have to focus on the task, but there is something hidden in the scenario. So you have to read scenario carefully, and what you should mark in scenario, what things you should look in the scenario, what you have to explain to the mother or caregiver or the patient. You should aware of the background of the disease or the condition, and definitely your task. So these things you should have to read carefully. You have 4 minutes outside the station for reading. Then I will tell you in the next slide what you should extract from this outside scenario. Definitely you should have to mark some key points. Poor time management. Sometimes the role player, they are asking a lot of questions, and it's your job that you should complete your scenario. It's only 9 minutes, and it's not the job of the role player. Role player, definitely role player has instructions to ask the questions. So they will ask you the question. Sometimes there is a scenario, many role players, they are continuously asking, and you cannot follow your pro forma, your protocol, what you study, that you have to close, you have to give a leaflet or trusted websites. Is all every step has marks. So it's your job how to stop a candidate in a good manner, in a good way. How to stop a role player, how to stop a role player in a good way, in a good manner. You can say them that yes, we have very limited short time, we will arrange another meeting, but I have to complete, I have to tell these things. So you should have to stop in the good manner. Okay, then misinterpreting the scenario, this is also common thing sometimes because of stress of the exam. One thing I want to tell you, each candidate, that you have multiple stations. Definitely you have the history, development, and video communication, clinicals. So what happened, for example, your previous station, previous case went very bad with the examiner or with the role player. That stress candidates has in the next station, and because of this previous bad station, it affects their coming scenario. Because of stress, I did this wrong, I did this wrong, my exam has gone. So these thoughts are going in the mind of the candidates. So my advice to all candidates, that there are total 10, there are multiple stations and there are passing marks, and definitely you will not necessary that you will get 100% in each station. If one station went wrong, it doesn't mean that you will do the wrong for the next. So keep in mind, when you come out from the previous station, leave everything there, go fresh to the next station, and you should give your full efforts for the next station. Don't think about the previous one. Don't take stress. Definitely stress is common. I will say, whatever whoever will say you, whatever they will say you, don't take stress. You must have stress, but don't show your stress. So this stress sometimes it's a good for the getting for the reminding, for the reminders and these things. It's a good thing, but this stress will not affect your performance. Your performance is very important. You have very limited time, and because of this reason, you should have be mindful when you attend this session. And poor performance because of exam stress. That's why I told you this stress is very important to control your stress. If you have a stress, keep inside your stress. Do not show your stress to the role player, to the examiner. Performance is very important, and this will come by practice definitely. And do practice as much as you can, because this all exam is about speaking. It's not about the listening, not about the writing. So it's all about the action. And in communication station, it's all about talking. If you are not talking, you are reading like in the theory exam, it will not help you. This exam is action. You have to say, you have to do. These are two things. It's not about the writing like the theory exam. You are listening, you are reading, you are watching. This exam is not like this. You have to speak out, you have to express your knowledge. So this exam is all about the action. Okay, so this is the scenario. This is a scenario in Mark BT book, and if you will see this scenario, I extract something in this scenario. For example, first of all, whenever the major mistakes they do, the candidates usually they call the by wrong name. For example, the mother name and the baby's name, child name. So they will call the mother with the child name sometimes, and sometimes they will call the a child with the mother name. They will do the vice versa. And even some role players, they are telling you, no doctor, I'm not this, this is my child's name. So it is also bad impression, because in communication station you are entering in the exam. From entering to the inside the room, examiner is watching even how do you walk, and what are your facial expression, your body language, your tone. Is your tone is matching with your expressions? Are your empathy towards the caregiver or towards the parents, your sympathy, how are you using the jargon, like the role player is not easy with your communication. So these all skills, definitely you have to face these, you have to focus on these things rather than the knowledge. The knowledge is important, but the other things is more important in communication station. How did you introduce yourself? Have you had a rapport with the role player? And did you ask about the previous knowledge regarding the scenario, whatever scenario you have? Or for example, if the scenario is of consent, like this scenario, and you did not ask about the consent, that why are you there? You didn't say that I'm here to take a consent. You told about everything about the blood transfusion, but you didn't tell the role player that I'm here, my job is here, my task is here to take a consent from you, to obtain consent from you. Definitely, if you don't ask about the consent, you will not reach to the task. Examiner will cut your marks, even though you did the 100%. You were sympathized, you are having empathy, you didn't use jargon, you did everything, but you didn't ask about the consent. It was your task. So these are the things you should have to focus. So this is the scenario, and you are the neonatal specialist trainee. You can introduce yourself by this, that I am a neonatal, or I am the specialist trainee of babies. Either you can introduce that I am the baby doctor, so whatever you should, but even though you are talking about the specialist trainee, that's fine. Then you know the name of the baby. It's very important. You can write on the paper. You have the pencil and the paper in exam. You can write on the paper the name, age, even the mother name. It will take maybe 30 seconds to write in on the paper. So please write in the writing that you can understand your writing. Sometimes we don't understand our writing even. So just write about the name, age, and also the mother name in a way that you can see that paper during communication. Okay, so here the name is Toby Gibson, and it's a 26 weeker. These are the things you should have to extract. It will help you during communication. And you know it's a background that he was a preterm. Now he's 4 days old. So here the background is respiratory distress syndrome, hypotension, required inotropes. This was the past history. You know that he is become anemic. Now this is the current thing that he became anemic. Okay, the you are suspecting this anemia because of frequent sampling. Definitely, role player will ask you why he developed anemia. Is he bleeding from anywhere? Then you have to tell about that what could be the cause of anemia in this baby. Here the cause they give you because of frequent sampling from the umbilical arterial line for gases and bloods, and it's very important to take the investigation. So you should tell the importance of the taking blood gas, frequent sampling. What are the reasons? Because of blood gases and bloods. So you feel that he will be benefit from transfusion. Now your feeling is that he will be benefit from the transfusion, blood transfusion. So what are the importance of blood transfusion? Why are you going to transfuse him? And reasons. First of all, you have to go for the reasons in the task, and then obtain consent. Okay, so if you will tell the role player that I'm here to take a consent from you, or you can say I'm here at the end of our communication, I hope that you will give me a consent for blood transfusion. Initially, if you are saying this, it means you are on the safe side, even though you will forget at the end or at the mid because of the a lot of questions from the mother. It's okay because already you told that you are there for the consent. So reasons for the blood transfusion, as you know, you have to tell the mother about the reasons of the blood transfusion. So this was about some mistakes candidates they do, that whenever you are going in the previous station, if it went bad, it does not affect your next station. And read the scenario carefully, take the extract from the scenario. You can write the name, mother name, age, disease, and your even task, 2 words, 3 words. You can write, you have 4 minutes, you can read, and you can take the this information from the scenario. The other thing, when you are entering in the room, just walk in a nice way, in a good way, be confident, but don't be overconfident. So and politely, you should have to be polite with the candidate. And in this station, many candidates, they are entering in the room. For example, if you are in the clinical side or in the history or in the development, the examiner will greet you, examiner will tell you, examiner will sometimes they are telling you a task. Like in clinical station, they will tell you that this is the child and this is what you should do. But in communication station, examiner is like he is not there. Only his job is to observe you. Even though you don't greet the examiner, it's better not to greet, it's okay. But if you will greet, it's up to you. But in communication station, examiner, you think that examiner is not there, and your time starts once you took your first step. Once you take step in the room, your time starts from there. So time is very important, time management is very important. So when you are entering in the exam, you have direct communication with the role player or the mother or the patient. So start from you go inside, sit, and start from there. Okay, so be confident, don't show your stress, your confusion on your face, and introduce yourself confidently. Once you introduce and you will make the repo, even you feel relaxed, then you know your task, what I have to talk about. Then definitely some questions from the role player, which you might you may say that I was not expecting these questions. So these are the things. But if you don't know it all and you think that these questions I was not expecting that he mother will ask from me, or you don't know, say straight away that I don't know. If any knowledge you don't know, that you can say that we will arrange another meeting, and I will read about it, I will ask about it, and then I will let you know. Even though you don't know, it's better to say I don't know, but don't give any wrong information. Wrong information is very bad in the exam. Don't give any wrong information. If you are not sure, then you tell straight away, straightforward to the role player that I am not sure about it. I will read, or I will ask from my senior, and then I will come back to you. So this is the best answer if you don't know at all. But usually candidates are very sharp, very clever. They know many things, but be careful that you don't use the jargon. If it is medical student, then definitely, or if it is a nurse, then definitely medical terminology is acceptable. But if it is a parent or a patient, medical terminology don't use, just avoid for medical terminology. So I hope this will help you. So be confident when you are in the communication station. Your station starts from you are entering in the exam. 4 minutes outside extracts the things which will help you inside. Make sure that you call them with the right name. Do not mix up the names, and examiner is watching these things. For example, if you did 100% in other things and you mix up the names, sometimes examiner will just forgive that. He said this candidate did well, so definitely they will not penalize you. But if you did not do well in other things, definitely examiner can write the comments. He was calling the role player with the baby name, he was calling the baby with the mother name. So these comments also some candidates have on their result sheets. So just take the extract from the scenario and write on the paper, and then go inside and introduce yourself. And at the end also you should have to summarize the case, and you have also uh, give them the leaflets, and also give them a trusted website. You should have to say this, because everything has the mark. So in communication station, it will help you if you will go systematically, and you will go there, because if you there are some key points, there are some keywords. If you are not saying these keywords to the role player will ask you again and again, again and again. He wants you to complete your task till your time has finished. So but in other side, sometimes role player has instructions. Even though candidate is giving you a right information, you should ask him 2 3 times more, because examiner wants to see that if a patient or role player is asking you in the real scenario, in the real practice, if they are asking you the information again and again, how do you tell them that if some candidate saying I told you before? No, you should have to tell them again, and it's not necessary complete explanation, but in the one sentence again, and then go forward. So it's okay if they are asking again and again, and you know that you gave the explanation which is already has been your explanation was well, and you explained them very well, but role player is asking me the same question again. Don't tell them that I told you before or I explained you before. No, you have to tell them again in the one sentence of this your explanation. So after 1 minute or 2 minutes, sometimes the candidates asking again. These things are happening with the candidates. Some candidates say I told you before, so it's not the communication. No, you have to explain again, but in one sentence. So these are the things you should take care of. I hope this video will help you. Subscribe the channel for more videos which will help you in the exam. Thank you very much.